Hi, I'm Dr. Jha from Rini Clinic in Leamington Spa. I've been asked to talk to you about a common condition called Molluscum Contagiosum. It is an infection produced by a virus called Molluscum virus, or sometimes they are also called pox virus. And this generally infects smaller children, toddlers, or maybe they're a little bit more older and so on. And they can also infect adults as well. And sometimes Molluscum contagiosum infection can also be genital. So the infection can be genital and non-genital. In children, most are non-genital. And the areas typically are face, neck, upper torso, and so on. And generally, they don't produce much symptoms other than mild itching in these spots. They are slightly pink in color, and typically there is central depression in these papules, and the papules generally measure about 2 millimeter to 6 millimeter at the most in their widest part, or diameter of 6 mm in general, 2 to 6 mm, anything like that. And the children, when it affects them, they are generally normally very happy child, and they don't have any other symptoms, and they are feeding okay, they are eating well, social interactions, everything is normal in them. But the parents are generally concerned or anxious about it. What is this child has got a new type of rash, and they consult the pediatrician or the children doctor for that concern. They do not have to be treated if the child is doing overall well, if the child is feeding okay, no feeding concerns, there is not running any temperature, things like that. We don't have to treat it actively. But many parents are concerned because the child is a little bit older. They are 7, 8, 9-year-old, 10-year-old, they have molluscum infection. They are going to the school and interacting with other children, and they get bullied and harassed. You got spots, new spots, etc., etc. So these children can seek, or the parents can seek treatment for these unwanted skin growth. Now, when you see a specialist, there are different options they may have. Some are treating with cryo liquid nitrogen, which is a freezing cold liquid sprayed right on top of individual spots. It's a little bit painful, not pleasant. But at our clinic here in Leamington Spa, what we do is slightly different. We apply numbing cream, we wrap it up and leave the child for an hour or so, and then we treat it with pulse dye laser. Pulse dye laser do give a little bit of bruising at that spot, and one may need 2, 3 sessions, maybe 4 sessions to clear these spots, but eventually they will vanish. Now, even if you leave them alone and don't treat them, it is expected generally that they will clear by themselves, and therefore we call it self-limiting disorder, by say 12 months or so. In adults, if they are concerned, again they can see skin specialist, dermatologist, and treated in the same manner like liquid nitrogen, cryotherapy. At our clinic, we treat it slightly differently. We give you tiny injections wherever they are. If they are in the body or genital area, tiny injection to numb the area, and then we vaporize in adults with carbon dioxide, that device, and generally one treatment and they'll be gone. Sometimes there can be some recurrence, and if there is a recurrence, of course, we don't charge you again within 3 months, because it is viral infection. Even after 3 months they can potentially come back. But if you had treatment at our clinic and you paid for the fees, etc., then within that 3 months period we generally treat it free of charge, no question asked. You will be wondering whether there will be any scarring and things like that. Well, with our device, whether it is pulse dye laser or carbon dioxide laser, there is no scarring or long-term scarring as such. So that's about the Molluscum contagiosum. If you got a spot, you're not sure what it is, seek help from your local specialists, local doctors, local GP and so on, and get advice and diagnosis and so on. You can always come back to us if you need to. We have a dedicated WhatsApp line which are handled by myself. I respond to them if they inquire about, if they send me a decent picture in good lighting. I'm always there to help and support. Thank you for watching. Do share and subscribe our videos. Thank you again. Take care. God bless.